Good evening, I'm Ian Hannamansing. The second wave set to crash through long-term care.
It's sad and difficult and terrifying to be in a position where all you can do is yell and scream and hope that somebody does something to correct it.
Why we may be headed for the same devastation we saw in the spring. And what should governments be doing now? Our doctors are here to talk about that and more. A young mother fights for her life.
All of a sudden, everything just went haywire.
The power of COVID-19 laid bare for one family.
All the delivery is coming from here.
So you ordered something online and it never showed up. How this shopper avoided getting stuck with the bill and how to protect yourself. This is The National. For months, the message on COVID-19 was clear: stop the spread. But every day, for dozens of people, it's too late. Across Canada today, there were 62 reported COVID deaths, and that doesn't include BC, which doesn't report on weekends. The numbers are in line with a grim trend. The daily average COVID death rate has more than tripled over the past month as infections soar. For epidemiologists, the rise in deaths is as predictable as it's painful. They warned us the virus eventually reaches the vulnerable. Many long-term care facilities may know what they're up against, but have still failed to keep out the virus. David Common has followed issues with long-term care since before the pandemic, and he traces the roots of the crisis now.
One of the deadliest outbreaks in Canada's COVID history is unfolding now in Winnipeg. Infections among staff starving the home of workers, leaving residents inside dehydrated and dying.
Tell me how they're doing, what you know about how they're doing.
Speaking on Rosemary Barton Live, Alvin Kodonic cried out for help for his aunt and uncle inside.
It's sad and difficult and terrifying. All you can do is yell and scream and hope that somebody does something to correct it.
In Ontario's Rockcliffe home, it's too late to get residents to safety. More than 80% have COVID now, 66 staffers too.
It's totally predictable and preventable.
But, says geriatrician Nathan Stahl, don't blame the workers, who are the likely source of transmission. Blame a province-wide staffing failure.
The workers overwhelmingly are women, have overwhelmingly not had full-time jobs. They may work in grocery stores or take on other jobs to make ends meet.
The second urgent task, he says, is to end the infection control nightmare of 3- and 4-person rooms. Dr. Stahl says government should decongregate people into empty hotels, even climate-controlled tents.
In Ontario, where a number of the big explosive and deadly outbreaks have happened, they've occurred in these older homes that continue to have occupancy in 3- or 4-person rooms.
Those rooms are more common in for-profit facilities, where a recent study found COVID, once in, was more likely to spread inside. And CBC News has learned a new complaint to Ontario's Integrity Commissioner alleges government MPPs have received political donations from the long-term care lobby, putting those politicians, it says, in a conflict of interest, just as the government is rushing the passing of Bill 218, which benefits those donors and companies by protecting them from certain lawsuits over COVID. The Ontario Health Coalition is behind the complaint.
That policy reflects the interests of the for-profit long-term care industry at the expense of the public interests and the interests of the residents and their safety in long-term care homes.
The Ford government has not yet responded to the complaint. One thing that is clear, the more present COVID is in our community, the more prevalent it will be in our nursing homes, and the more vulnerable people who will get sick and die. David Common, CBC News, Plevna, Ontario.
The first defense against COVID is our own behavior. Physical distancing, hand hygiene, wearing masks. The last line of defense is hospitals, now rapidly filling up. COVID-19 hospitalizations in Canada have nearly doubled over the past month, but the trend has accelerated, with 400 additional beds occupied in just the past week. Valeria Corimanocchio shows us in some parts of the country the system is already reaching its limit.
In Manitoba today, another record-breaking number of COVID-19 cases. It's grim news for some hospitals that are already strained.
We get a call that a COVID positive is coming from the community. So they will drive up to the front of the hospital. They will phone us, and then They will come in, be triaged, and if they're stable enough, they will often go back and wait in their vehicle for hours before we have a bed to put them into.
Dr. Teresa Tam is concerned about the spike in hospital admission across the country. Her statement today, they are putting pressure on local health resources, forcing hospitals to make difficult decisions. Already in Saskatoon, officials say intensive care units are filled beyond capacity because of COVID-19 patients. ICUs have stopped accepting some patients.
Now is the time to get more people.
The Registered Nurses Association of Ontario says it's time for more boots on the ground in ICUs. Models released earlier this week showed Ontario hospitals could be overloaded within weeks. Grinspan says nurses are exhausted and struggling.
Now is the time to bring the resources, not wait a week or two.
In Quebec, COVID hospitalizations have remained fairly stable over the last few days. This physician and infectious disease specialist says hospitals aren't overrun, but the situation is fragile.
We're gradually losing our capacity to deal with if there were to be a sudden surge either from COVID-19 in a vulnerable population like a CHSLD, or we are of course entering the wintertime flu and cold season.
Outen says with that season approaching, many hospitals in the province could be dealing with flu patients and COVID-19, and that could be a deadly combination for hospitals across Canada. Valeria Corey-Minocchio, CBC News, Montreal.
Throughout the pandemic, we've seen that some communities can be hit harder by COVID-19. Magda Gabrisalasa shows us why South Asians in Canada seem at higher risk and what some doctors are hoping can be done to fix that.
So here is our main home shrine.
During Diwali this weekend, the Patel family stayed safe, attending temple online.
We are missing our friends, but yes, with technology, we are good.
It was a different story at two outdoor events in Ontario this weekend, shut down by police. A scenario doctors behind a Toronto Star opinion piece were hoping to avoid by shedding light on the transmission of COVID-19 in the South Asian community. Zane Chugla is one of those doctors.
In Brampton and Peel region, we talk about 30% of the population being South Asian, but nearly 50% of the cases being South Asian.
He says it's happening across the country, so he calls on South Asian Canadians to protect the multi-generations living in one home and to avoid having guests and to realize they're at special risk.
This is a very forward-facing community, that there are a lot of public jobs and ones where people are getting repeated exposures.
This emergency room doctor also wants to address the lack of accessible information on COVID-19 safety measures.
So I think we need increased messaging in different languages.
So online, as part of the newly formed Seek COVID Task Force, her team is offering how-tos in English, Punjabi, and Hindi.
How to take precautions, how to isolate, how to take the screening test if you think you have symptoms and you think you need to get tested.
This head of a South Asian group wants to make sure that all this talk won't lead to blame.
You're blaming the victim of hardworking, tax-paying individuals who have been cheated of the resources that they need in order to combat disease and ill health in general, but this pandemic in particular.
He says long-term underfunding of public health has put racialized communities at risk, and that needs to be addressed. Magda Gabrisalasa, CBC News, Toronto.
Manitoba broke a record with 494 new cases today as the Justice Minister spoke out against an anti-mask rally. Cliff Cullen said the actions on display in Steinbach yesterday were incredibly unfortunate, dangerous, and wrong. With 93 deaths recorded in November, this has already been Manitoba's deadliest month from COVID-19.
I really do think we're at a turning point. We saw numbers in Alberta break over 1,000 cases just yesterday.
Calgary's emergency measures manager is calling for a circuit breaker lockdown to stop transmission of COVID-19 after Saturday's record-breaking tally of 1,026 new cases in Alberta. Sunday's number dipped to 991. And Nunavut reported an astounding 10 new cases today, more than doubling the total to 18, most linked to the small community of Arviat. Anyone who left on or after November 2nd is asked to immediately isolate for 14 days wherever they are. British Columbia's health minister says the province's health care and long-term care systems are struggling as COVID cases rise and points to two areas in particular that are being hit hard.
We're seeing more general transmission across British Columbia. It's not uniform. It's principally in the Fraser Health Authority, which is the suburbs of Vancouver, and the Vancouver Coastal Health Authority. And so we've had to take some significant action.
Nearly 70% of Friday's new cases were in Fraser Health Region. Now 3 schools in that area are closing for 2 weeks because of outbreaks, one each in Delta, Surrey, and New Westminster. A BC man says his family's experience should be a lesson to everyone of just how devastating this virus can be. Not only is his wife in the ICU, but his baby boy had to make an emergency entrance into the world. Briar Stewart has their story.
For Dave McIntosh, the trip to this hospital is truly bittersweet. Inside, his wife is fighting for her life after another was welcomed into the world.
I was thrilled to find out that he was a healthy baby boy.
When she was 36 weeks pregnant, Jillian McIntosh gave birth to a baby boy, but she doesn't know it yet. Earlier this month, she started feeling ill. She thought it was because of her pregnancy, but she went to the hospital.
That's when they found she had pneumonia and had tested positive for COVID. They said she would just be in there hopefully a couple days while they checked her out, and then all of a sudden everything just went haywire.
His wife ended up on a ventilator and was given an emergency C-section. McIntosh couldn't hold his son until 36 hours later when his COVID test came back negative.
It was awesome. It was such a relief, without being able to go and see his mom and hold her hand or anything, to finally be able to go and see him after waiting and waiting.
McIntosh is hoping his son can come home this week. As for his wife, it's unclear. She's still in a coma and on a ventilator.
McIntosh says they don't know where his wife caught COVID-19. They were both wearing masks and taking all of the precautions. He said she wasn't going anywhere besides the daycare to pick up their 3-year-old daughter, and neither she nor McIntosh tested positive for the virus.
With the number of COVID cases rising, he says people need to realize that everyone is vulnerable. His family's experience is a cruel example of that. A nurse from the ICU told McIntosh that at one point his wife's eyes fluttered.
The nurse did mention to her, "Oh, you've got a beautiful, healthy baby son," but maybe she heard that. I don't know. I hope she did, but if not, she's got a big surprise for her when she wakes up. So.
And he says only after that will they officially name their son. Briar Stewart, CBC News, Abbotsford, BC.
The U.S. has hit yet another pandemic benchmark. It's reached 11 million total cases, with at least 136,000 of them just today. There have been more than 100,000 new cases every day over the past week and a half. Michigan's governor said tonight she fears her state will see 1,000 deaths a week. So she's banning in-person high school and college classes, as well as indoor dining, as of Wednesday. President-elect Joe Biden's chief of staff is calling the COVID situation very grave. Biden's science team will talk directly to vaccine makers because he's still not being given access to White House briefings. Paul Hunter with the latest on how the current occupant is digging in.
Still refusing to acknowledge defeat in this month's election, Donald Trump today went golfing, but not before he tweeted, seeming to suggest Biden had won, but as he put it, only because the election was rigged. Then, seeming to backtrack anyway, "I concede nothing," he wrote. For the record, there remains no evidence the election was rigged. As the Biden team put it today,
Donald Trump's Twitter feed doesn't make Joe Biden president or not president. The American people did that.
Still, a day after Trump's hardcore supporters marched on Washington, themselves in turn supported by Trump himself, Biden's team underlined most Americans see it differently, and that the president's intransigence comes with a price. On files soon to confront Biden, not least the pandemic, Trump is also blocking Biden's team from briefings with government officials, a key part of the transition process.
Joe Biden's going to become president of the United States in the midst of an ongoing crisis. That has to be a seamless transition. Our experts need to talk to those people as soon as possible so nothing drops in this change of power we're going to have on January 20th.
Of course, it would be better if we could start working with them.
Anthony Fauci, lead scientist for the White House on the pandemic, today underlined the value of a smoother transition, especially now, while noting when it comes to official White House briefings on COVID.
The last time the president was physically at a task force meeting was several months ago.
Tonight, Trump remains focused on his unfounded allegations of voter fraud, despite most courts so far rejecting his legal challenges. As Joe Biden now tries to move forward, the country itself tonight still mired in political disarray. Paul Hunter, CBC News, Washington.
Canada's ambassador to the United Nations is asking the Human Rights Council to investigate whether China's treatment of Uyghurs amounts to genocide. Bob Ray spoke to Rosie Barton earlier today.
There's no question that there's aspects of what the Chinese are doing that fits into the definition of a genocide in the Genocide Convention. But that then requires you to go through a process of gathering information and of making sure that we've got the evidence that would support that kind of an allegation.
The request comes after a report by a House of Commons committee said China's treatment of the ethnic Muslims, including mass detentions, forced labor, and forced sterilization, is genocide. China said that report was, quote, full of lies and disinformation. Transport Canada has suspended 6 employees without pay because they spread a racist email at work. They all worked in the department that oversees enforcement of Canada's no-fly list, a program criticized for mistakenly flagging Canadians, even children, as security risks. Ashley Burke has the latest on the story she broke.
This is the email that started it all.
Former Transport Canada worker Renee Suderuk says speaking up about this email ruined her career.
Strangers on my flight.
It's a parody of a Frank Sinatra song threatening violence against turban-wearing travelers. Her superintendent at the time, Mark Haynes, sent it around the office in 2008 and wrote, "This is great. They should play this nonstop at all airports."
The last decade of my life has been largely about dealing with the repercussions of having come forward and speaking up against the Islamophobic email.
Transport Canada was told twice about the email years ago, but didn't take action.
Well, I was horrified.
Until a CBC News story last year prompted the minister in charge to issue a new investigation.
There's no room in Canada for this.
This time, the department found not 1, but 10 people spread the email at work between 2006 and 2010. The deputy minister sent a memo to all staff earlier this week and said, while this happened years ago, this kind of behavior is always unacceptable and will never be tolerated. Distributing these emails was an act of systemic racism. Accordingly, the 6 remaining employees have received unpaid suspensions.
I was relieved that they finally took it seriously.
Ruby Alvey's 3 sons are mistakenly on Canada's no-fly list. She met with the deputy ministers to learn what steps it's taking next to deal with systemic racism.
This is really the beginning. The 6 unpaid leaves is huge.
And hopefully this sets a precedent that no government agencies or affiliates should ever, this should never be allowed.
Suderik's surprised but not satisfied.
I have a pension that is forever abbreviated, forever truncated as a result of having spoken up. And the individuals who shared the email, the individual who authored the email will receive a suspension, and that's it.
She calls it unjust and worries whistleblowers may not speak up in the future. Ashley Burke, CBC News, Ottawa.
4 astronauts are on their way to the International Space Station tonight after a history-making launch.
Ignition.
And resilience rises.
3 of the astronauts are American, 1 is Japanese. They lifted off in a SpaceX rocket this evening for a 6-month mission. It's NASA's first fully operational flight using a private company, SpaceX, which completed a successful test flight earlier this year. The astronauts named their capsule Resilience in recognition of 2020's many challenges. The pandemic has created a surge in online shopping, but some buyers are finding they're not getting what they wanted because it never arrived. Worse, they're still on the hook for it. 2 shoppers have decided to go public about their experiences. Here's Rosa Marcatelli.
Music is Vardan Hovakiman's passion. He saved up for more than a year to buy an electronic drum set like this one at a local music store. But it only took a few weeks to be told it was lost in shipping. And he was on the hook for the almost $2,000 he paid for it.
I was humiliated and very, very angry.
All the delivery is coming from here.
Then there's Kamyar Yosefi. He only got his money back from the retailer after CCTV footage showed his $300 clothing order was never delivered, despite getting a proof of delivery email notification from FedEx saying he'd signed for the package. The company later told Go Public the package was likely delivered to the wrong address, triggering that confirmation email.
They said that because of the COVID-19 issue, even if it's required for the signature, they don't get any signature.
Not only did these men not get what they ordered, but things got more complicated because the businesses they ordered from have policies that say the buyer is on the hook if an order is lost in shipping. The thing is, legally, companies can't do that.
It's certainly not unusual that companies will write contracts that are one-sided.
Online shopping sales nearly doubled during the pandemic, from $1.6 billion in February to $2.8 billion in August, according to Statistics Canada.
So what should happen when orders are lost? Consumer protection laws say buyers are entitled to a refund within 30 days of the promised delivery date. But taking advantage of those laws often means going through small claims court. Instead, experts say use a credit card when shopping online, not an e-transfer or something else. So you can dispute that charge with your bank if you don't get what you paid for.
The law is on consumer side, that I do believe, but it is a long, arduous process that I think you can avoid by using a middleman like Visa, MasterCard, or PayPal.
Hovakiman eventually did get a refund from the music store, but only after the shipping company found the missing box a month later. He says he's sworn off online shopping for good. Rosa Marcatelli, CBC News, Go Public.
And our Go Public stories come from you, so if you have a tip for Rosa and the team to investigate, send an email to gopublic@cbc.ca. The pandemic has forced some high schools to change how they break down a typical semester.
It's been really difficult to not only focus during the 3 hours, but also just process everything.
Up next, why this may be creating more challenges for students. Plus, making sense of the second wave, we check in with our doctors about the direction the country is headed in. And later, a Toronto trio dancing their way through these difficult times.
The world's in like a kind of a turbulent place, so I feel like people get a lot of joy from what we do.
Why their message and moves are resonating beyond their basement. We'll be right back. As COVID case counts rise, many of us have questions about how to react, so we've brought in a couple of infectious disease doctors to address some of those. Dr. Isaac Bogosh from the University Health Network and Dr. Suman Chakrabarty from Trillium Health Partners. And Dr. Chakrabarty, let me start with you. We ran a story earlier in the show addressing the South Asian community being hard hit by COVID, and you co-wrote a commentary in the Toronto Star raising this concern. What do you hope happens next?
Yeah, this is a problem that many of us notice across the country in the medical field, that there are many South Asian people who are acquiring COVID and also having very severe outcomes. So our goal was to get the information out there just to show that this is happening and try to put this away to start the dialogue, see if you can do something that would change behavior and also kind of recognize what's happening, because it's quite the problem, and we wanted to do whatever we can to help, and getting messages from inside the community I think are the most effective.
Well, to bring attention to any particular ethnic community can be a delicate process. What kind of reaction have you received so far?
So far, mostly it's been positive because I think that most people that have been responding have also noticed the same thing themselves. But I do want to emphasize one thing, that this is meant to be something that is a positive thing to kind of help things out and not do this in a judgmental way, because we know that there are specific factors in the South Asian community that have overlapped that causes this increased risk. And our goal is to kind of help bring the message from within. It's always easier to get messaging from somebody who you trust inside the community rather than just somebody that's talking from a community from above.
All right, let's move on to another issue now. And Dr. Bogosh, we're hearing from a lot of people, even within our own newsroom, who are confused about what the rules are that apply to them when it comes to COVID. Any advice on how people can clear that up?
Yeah, certainly I can understand why there might be some confusion. The rules have been changing over time as we've learned more and more about this infection, and the policies have changed. And in addition to that, sometimes they might not be communicated in the most effective manner. I think the best thing to do with this is to really find a couple of reputable sources, like the municipal public health website or the provincial public health website, because all those rules and recommendations are updated on a regular basis, and they're in an easy to read format, usually in multiple languages for people to understand. So I go to those websites for the most up-to-date rules.
There is a big debate happening across the country. I'm sure you guys know this, probably within the medical profession, certainly outside, of people wondering what should governments be doing to stop the soaring case counts. So, you know, you guys are independent doctors, so let me put the question to you, and Dr. Chakrabarty, first to you. If the Premier in Ontario said, what should we be doing differently to try to deal with what's happening now with COVID, what would you say?
Well, right now with the soaring cases, I do think that unfortunately in the next short term, we're probably going to be seeing something like a blanket lockdown to kind of get things under control quickly. But that said, this is with the plan so that once things are opened up safely, you can do so to try to keep these cases as low as possible. And part of that is really understanding where the cases are coming from. It's unique from neighborhood to neighborhood, region to region, whereas in one place, restaurants and bars might be a big driver. That's not the case in many places, such as where I am in right now in Peel. So it's important to look at all the factors broadly, consider those, and then try to attack those in a more direct fashion to keep things under control.
So can I ask you, is your view that we should have a lockdown, or at least you in Ontario should have a lockdown?
I think for a short period, yes, because when you have the case to the level that we have right now, it's very difficult to keep these under control without doing something more broadly with a blunt tool. But later on, once things have gotten better under control, we need to do things with much more precision than a lockdown can give us.
And Dr. Bogosh, what do you think should happen?
I'd ask some questions, and I certainly would ask, what are the drivers of infection in the various communities, and what are you taking to stem those infections from occurring? And all the policies we have are great, but if you're not actually stopping transmission where it's happening and understanding where transmission is happening, who's getting infected, where they're getting infected, and what the context of the infection are, then it's going to be challenging to control. I'd also ask, how are you going to bolster your test, trace, and isolate strategy? And lastly, I'd ask, how are you going to support individuals, communities, and businesses that are disproportionately impacted by the virus and by some of the policies to control the virus?
One last question, and again, I'll put this to both of you. We all heard the news from Pfizer about what they feel is very optimistic progress with a vaccine. Dr. Bogosh, what was your reaction when you heard the news?
This is fantastic news. I mean, we only have some snippets of the information, so I think I have cautious optimism, but I really look forward to seeing what the rest of the trial shows. I'm also very interested in the other vaccines that are in very advanced stages of development and look forward to hearing those trials. Obviously, some of them might not work out, but I think some of them will. And I think 2021 might start off on a sour note, but I think we will see vaccine rollout early in the year. And I think 2021 is just going to get better and better and better as we go on throughout the course of the year.
I like the sound of that. Dr. Chakrabarty?
I agree with Dr. Bogosh. I also have cautious optimism. I also want to see the data myself, but I do think this is finally some light at the end of the tunnel. I do think we're going to get back to the life that we had before. It's going to take a while, but at least now we actually have the means of doing it. Hopefully, 2021 will be much better, I think, than 2020.
All right. Well, always great to talk to both of you. Thanks for your time.
My pleasure.
Thanks for having us.
And while we wait for that vaccine, many schools have been forced to adopt new systems to divide the traditional school year. Deanna Sumanag-Johnson looks at how some students are managing and how some teachers have to get creative.
Grade 12 student Kamaldeep Dhillon wants to go to university, but says that keeping her grades high is harder this year. Her school year is now broken up into 4 quadmesters. Each contains only 2 courses, making each day's classes extra long.
It's been really difficult to not only focus during the 3 hours, but also just process everything.
In Saskatoon, Bridget Solomon is also in her final year of high school and not a fan of her quintmesters. That's 5 sections of the school year.
It's been very stressful.
Each quint lasts just under 2 months, a short time to try to pack in the content of an entire course.
I feel like there's a lot of information that we're supposed to absorb in such a short time frame, and it's not working for me.
Quadmesters, quintmesters, even octomesters were all put in place to limit student interactions during the pandemic. But critics say this reshuffling has a real impact on education.
They're not as, I would say, efficient in the use of learning time. They're not covering nearly as much of the subject content. And over time, that tends to degrade the quality of education.
Teachers like Vanessa Moe are doing their best to break up the long classes.
We try to make sure that we engage students in more kinesthetic activities, so they're doing things with their hands.
But for students like Kamaldeep Dhillon, these changes to high school schedules could affect their future. University applications are due soon.
I feel like right now I'm a lot more focused on getting a certain grade that's required for programs, as opposed to actually understanding everything that I'm learning, because there's, again, such a short period of time.
More adaptation as the pandemic yet again pushes the stress of high school to a whole new level. Deanna Sumanak-Johnson, CBC News, Toronto.
Up next, making sure Black women with breast cancer are seen.
Seeing other women who look like me with scars like mine just would have helped to normalize the experience and make me feel more normal.
What's behind that lack of representation and how one project is working to change that? And later, adapting from one crisis ahead of another, a farmer's green mission. There's a new resource for Black women diagnosed with breast cancer in this country, one that highlights the treatment path of people who look like them. And as Joanna Remiliotis tells us, it all began with one woman who saw the need firsthand.
She has a loving family and a new puppy. But Michelle Audouin says, in the fight of her life, she's needed something more. She needed to be seen.
Seeing other women who look like me with scars like mine just would have helped to normalize the experience and make me feel more normal, part of a community.
Very good. Michelle's normal is a scary place. She was diagnosed with metastatic breast cancer 3 years ago. After undergoing a double mastectomy, she opted for reconstructive surgery and ended up in a whole new battle.
I really wanted to see women that looked like me who've had a similar type of surgery and see their scars. And when I asked around, they all seemed to assume that it was easy to find. And then as they, looked for things, they realized that these images didn't exist.
And how did that make you feel?
It was really disheartening. It sent a message to me that my experience didn't matter.
Michelle knew she couldn't be the only one who felt invisible.
Being a Black woman with breast cancer has been a very lonely journey.
So she joined forces with a charity she was involved in to help create this.
We're important and we need to be recognized and represented.
Uncovered, a breast recognition project, a resource to give other Black women the chance to share their scars and their stories.
Leading up to it, there was a lot of sleepless nights for me, just a lot of apprehension about uncovering my body and my scars, because I generally don't look at my body anymore. And I was really, really scared. But at the end of the shoot, there was just this expression of joy, relief. It was just the most beautiful thing, that everybody walked in with a similar experience and walked off feeling so much better about themselves.
It's really important to speak up.
It was empowering, and it filled a void that is now being recognized.
I think that's our responsibility to ensure that there's diversity and inclusion in the materials. And I think up until now, we have not done a good enough job.
Dr. Tony Zong is a plastic and reconstructive surgeon at the University Health Network in Toronto. She has done research on the diversity of the patients she helps, but acknowledges the material provided to them doesn't reflect them all. Michelle's project is a tough wake-up call.
Their outcome, their experience matter greatly to us. So to know that we could have done a better job, I think it's important. It's important for us to learn from these lessons.
The lessons also raise broader questions. It's not clear how breast cancer affects women of different backgrounds or what their outcomes are. Canada hasn't collected race-based health data, but is currently working on how to start.
I think in Canada we've traditionally seen ourselves as a colorblind society or as a place where racism doesn't exist. You know, we have to recognize what our history is and what's been happening here, and being colorblind is actually not a safe approach.
Aisha Lofters is a doctor and researcher focusing on cancer screening and health equity issues. The Uncovered Project, she says, speaks to a systemic lack of representation in healthcare and the need to address it.
You want to know that you're not alone, that you're not the only one, and you also want to know that the healthcare system sees you as who you are and that they don't view you as an other or as an oddity or as an exception. So to know that there's a specific effort made for people who look like you and who come from your experiences, your background represented, I think is really key.
The new pamphlets are being distributed to cancer care centers across the country.
When you see a project like Uncover, what do you hope it starts?
I hope it starts a conversation like this one that we're having, right? The fact that we are here talking about specifically about Black women in healthcare in Canada is not a conversation that traditionally has happened. So I think it's amazing just from that point of view. This is just one of many conversations.
As for Michelle, one of the most powerful conversations she's had since was with her 13-year-old daughter.
The first time my daughter actually saw my scars was when I brought home a copy of the Breast Recognition Project. Her eyes lit up. She was just so touched. You know, she thought it was just beautiful and really empowering, the stories that were shared, and she thought that I looked strong and beautiful, and that really meant the world to me.
Michelle is still fighting her cancer, but it helps knowing she's now part of the picture of what that looks like. Joanna Brumeliotis, CBC News, Toronto.
When we come back, turning a crisis into an opportunity.
Everything's been shut down, and that's a moment to think about how we want to start it back up again.
How a farmer is using the pandemic to adapt to a more sustainable way forward. Welcome back. Hurricane Iota continues to gain strength as it barrels towards Central America.
Deben evacuar a los sitios seguros.
People in the path of the storm are being told to flee. Iota is forecast to become a dangerous Category 4 hurricane when it makes landfall tomorrow. The region is still recovering from Hurricane Iota earlier this month. A deadly typhoon has made landfall in Vietnam, where thousands of people have been forced from their homes. This same storm killed 67 people in the Philippines, a dozen still missing there. It's the worst flooding in the region in more than 4 decades. Experts say natural disasters such as those are only expected to intensify with climate change. But in Ontario, there's a farmer who's on a mission to make a difference. Nick Purdon met with him to discuss a way out of our biggest environmental problem, even amid a pandemic.
Well, if we don't change the way we grow our food, it's going to become impossible to grow food. I mean, we're talking about going to Mars. So if we can do things like that, we can surely transition our economy to one that's more sustainable.
Tony Neal has been growing vegetables for 13 years on his farm in southern Ontario. He ran a prosperous business, and then came COVID.
Well, in the spring of this year, all of our markets shut down. And last year we were doing 6 farmers markets in Toronto, and in 1 week they all closed along with everything else, and so it was a real shock to the system.
But then something Tony didn't anticipate happened. With the public's concerns about grocery stores closing and food shortages because of COVID, there was a new demand for his produce.
People, I think, were starting to worry about supply chains. Where does their food come from? Is there going to be enough? And people were reaching out to local farmers to try and get access to healthy, nutritious, organic food.
And so sales of Tony's food baskets took off.
Okay, who's driving it back?
He went from 80 orders to 400 in just a couple of weeks. And that made him realize that the pandemic isn't just a problem. It could also be a big opportunity.
It's part of the thrill. The COVID crisis has given us a bit of a societal pause to start thinking about the ways in which we live. Are they sustainable and are they viable? Everything's been shut down, and that's a moment to think about how we want to start it back up again.
And Tony believes sustainable farms like his are the way to go. Because remember, before COVID, we were already in a crisis with climate change.
Solving the climate crisis matters to me because I care about people. I care about my community. I want to see people thrive, no matter who you are, no matter where you're from.
And you might be surprised to know that farmers are a huge part of the problem. 1/3 of all greenhouse gases come from agriculture. And Tony believes right now is our chance to change that.
So we've had a diesel tractor for about 8 years. About 3 years ago, I had put in a long day on the diesel, and the idea just came to me. Wait a second, there's got to be someone working on an electric tractor.
Tony found a company in California that had just produced a prototype. He became one of their first customers. But Tony didn't stop with the tractor. He put up solar panels to run it. He understands that an electric tractor doesn't have the power to help on all farms, but he insists there are simple things that every farmer could do. Take this field, for example. Tony pulled the potatoes and the squash out in June, but instead of leaving the ground bare, as many farmers have traditionally done, right away he planted oats as a cover crop.
It's quite a simple process to spread the oats and let them do what they are here to do, which is to grow and to use carbon dioxide and sequester carbon from the atmosphere. So some of the solutions to climate change can be super high-tech 3D printed solar panels, and some can be just letting nature do its course if you make the right move. You know, it's actually,
if every farmer in the country cover cropped, Canada could potentially sequester around 10% of its carbon emissions. There's another way that cover cropping benefits farmers. It acts as a natural fertilizer. So Tony doesn't need to buy synthetic ones, which contribute to climate change. The other thing Tony does is prepare the next generation of farmers. Take Basha Thompson. She's an apprentice here.
As a young person, it's my future that's going to be affected by the foundations that we set now. We need to be accountable to that. And I find just being in physical contact with the soil and with the vegetables themselves to be like, just kind of fills my heart.
Basha can keep working on the farm and become a manager and eventually a part owner if she wants. Tony argues this opens up farming to the next generation.
Myself and everyone who works here is very proud of what we accomplish in a day, and we feel good about it. It feels good to work together on a common goal.
When you look at all these vegetables, what do you think about?
Once they're washed and looking bright like this, it's an amazing sight. This is the end of all our hard work.
COVID is still the main challenge we face today, but maybe Tony's right, and we should use it to tackle the problems of tomorrow. Nick Purdon, CBC News, Sunderland, Ontario.
After the break, creating a new kind of routine in 2020. The story behind the basement gang's success is next in our moment. Those moves can be found all over social media these days, but it turns out the group is from Toronto, and this is where the magic happens, in their family's basements. They call themselves the Basement Gang, and their videos have gone viral, sharing dance moves with the world during this moment, and their story is tonight's moment.
Our videos are very organic, and what you see in the basement is what we do on a regular basis and what we've been doing for years now, since high school.
How it happened one day is we were just chilling in my house playing video games. My dad started playing music, So we all got up and we started dancing around, and that became more of a every time thing when they came over.
There's no choreography.
It's show up, here's the song, and try your best.
Someone was hop in the front, do something, and then okay, let's do that. We'll all just keep doing it. We'll switch moves. Sometimes we'll have like our own like little solos, and it's just really just that's all it is.
The world's in like a kind of a turbulent place, so like I feel like people get a lot of joy from what we do, even if it's just for a minute or two.
I think their first video was the one that used the song from a-ha as the background, and I had so many friends of mine who forwarded that to me because they just found it so joyful. But if you're trying to go viral, you never know which platform's going to work. They released their videos on Instagram and some other social media. No luck at all. Then TikTok, and suddenly all the rest is the moment. That is the National for November the 15th. Good night.